Today we have Dan Weinstock, who's a McGill professor. He's a philosopher, but he's also the director of the Institute for Health and Social Policy and an all-round super smart guy. And he is going to talk today about, he's going to include today some wild and speculative thoughts about social distancing and how we ought to be thinking about it. So without further ado, let me turn it over to Dan Weinstock. Dan, thank you very much for being here with us today. And you can take it away.
Thank you very much. And thanks very much, Chris, for the invitation to speak to the Max Bell School. It's a great pleasure. So I think that when we think about policy for our response to the pandemic, we have to do so under a number of different sets of assumptions. Nobody knows what's going to be happening with respect to therapies, with respect to a vaccine in the next 6 months, in the next year. So we have to envisage a number of different scenarios. And my talk today is going to be premised on what may end up being a false scenario, a scenario that won't come to pass. That scenario is one under which, first, we don't actually do a lot better than we're doing right now in terms of attenuating the symptoms and the mortality associated with COVID. So we're still dealing 6 months, a year down the road with a virus that is on the order of 10 times more lethal than the flu, than the seasonal flu. The other set of assumption, so the assumption that sort of moves from that is that distancing, which was first presented to us, certainly in Quebec, as something that we were going to have to engage in for weeks or maybe at most a couple of months, is something that we'll have to be engaging in for many more months and indeed perhaps for years. The messaging that has come out of different levels of government has been quite varied on this front. Here in Quebec, I think we've heard a message from the provincial government to the effect that distancing would not be a permanent or semi-permanent aspect of our lives. I think that Theresa Tam and Prime Minister Trudeau have been a lot more circumspect about that and have at least opened the possibility that distancing might be something that we have to deal with for the foreseeable future. So I'm dealing with a moderately pessimistic scenario under which, until we find a vaccine, say a couple of years from now, before we can both discover it, produce it massively, and administer it to a good part of the world's population, we will be living in circumstances that are analogous to the ones that we are in now, which is that our success in limiting the spread of the virus will depend upon our instantiating distancing measures in a fairly radical way. Now, here is the concern that I start off with. The worry is that as we move from weeks into months, into several months, into potentially years, compliance with distancing measures as they are presently instantiated will become more and more difficult to assume. So a couple of little bits of just to motivate that thought. There's a study that came out of Italy just recently about people's willingness to comply with very strict stay-at-home measures. And what that shows is that your ability to continue to comply with such measures depends on the initial expectations that are laid out by the government. If the government tells you that we're going to be distancing for a year, and it turns out we only have to distance to confine ourselves for 6 months, you're much more likely to accept that 6 months than if you're told at the outset it's going to be 3 months, and then after 3 months, you're told that it's going to be 6 months. The amount of time might be the same, but what the initial set of expectations are will alter your ability to continue to comply. Now, the government here in Quebec has certainly given us the impression that this was a limited phenomenon, a phenomenon that we'd have to deal with for the next few weeks rather than the next few months or years. So I think we have to think about that. Add to that the fact that in Quebec, as the weather gets better, people's willingness to stay at home will understandably reduce. I am worried about the first few days where the weather goes above 15 or 16 degrees Celsius, which it hasn't done so far. I'm worried about people's both contextual and more general willingness to comply. So the question that I think we have to ask ourselves in circumstances where, one, distancing is going to require, the limitation of the spread is going to require distancing, but distancing in its present form is going to be more and more difficult to assume compliance with. In other words, if distancing means stay at home, it's going to become more and more difficult to comply with. The expectation that the government has that people will continue to comply, I think, becomes less and less. We're going to have to think about different ways in which to achieve the goals of distancing without confining, without cleaving by an extremely exigent stay-at-home version of the distancing policy. So those of us who work in other fields of policy recognize a pattern here, a pattern which goes under the name of harm reduction policies. So harm reduction policies basically take the following form. You note that there's a form of behavior that is either controversial or downright condemnable, but you also note that the ability of the state and its law enforcement forces to enforce a prohibition on that behavior is limited, or would require the kind of uptick of surveillance and enforcement resources that would be unattractive even if they were attainable. And you also note that the continuation of enforcement policies, of the attempt to enforce a prohibition, despite this impossibility, leads to, in a way, the worst of all possible worlds. It leads to a situation in which people aren't complying, but their non-compliance is, as it were, unregulated. So you neither get the benefits of prohibition of the behavior, nor do you get the benefits of regulation. So think about areas like drug policy, think about areas like the regulation of sex work. We have, historically in Canada and elsewhere, found ourselves backed into a situation where I think it's arguable that we find ourselves in this worst of all possible worlds. It looks for all the world like the behavior is legal because it is not effectively regulated. Prohibitions against it are not effectively enforced, and yet we don't get the benefit of regulation that might dampen down some of the harms associated with the behavior, thus harm reduction. So similarly here, the concern that I've been having over the course of the last few weeks as we look into the future and think about the possibility that distancing policies will be required for months and perhaps even years to come, I worry that we might end up in a situation which is similar, one of unregulated non-compliance, where people start voting with their feet, not abiding by the very strict stay-at-home kind of constraints that have been the norm thus far, and we end up getting none of the benefits of these policies. There's some modeling that's been done by people in the engineering department at the University of Sydney in Australia that shows that you have to have somewhere between 70 and 80% compliance with contact restrictions in order for the benefits of distancing to really make themselves felt in terms of the limitation of the spread of the virus. If you get down below 70%, in a sense, you may as well not be doing anything at all because the network effects of contacting will still make themselves felt disproportionately. So we need a policy that instantiates distancing, but that doesn't run the risk of non-compliance, which I think will come to be associated more and more with stay-at-home policies. So there's a practical problem. There's an enforcement problem with stay-at-home policies. As an ethicist, I also want to spend a couple of minutes thinking about some of the normative or moral problems associated with stay-at-home policies. It doesn't take very long to realize that stay-at-home policies are amongst the most inegalitarian policies we could possibly imagine in order to counter the spread of the coronavirus, because that resource that is specified in the phrase stay at home is one of the most unequally distributed across even a fairly affluent society like Canada, to say nothing of the global scale. I live in a very nice, large house where each one of my family members can repair to a different room, maybe even a couple of different rooms if they want to achieve a little bit of isolation from one another. When the weather does finally get nicer, we have a backyard and a front porch. We'll be fine. Not everybody lives in those kinds of circumstances. People live in circumstances that are physically straitened, that are quite exiguous. They don't have much space. People live in circumstances where their home environment is one in which they are potentially victims of abuse, abuse that goes unnoticed, undetected, and is continuous if they cleave by a stay-at-home restriction. So staying at home means very different things to very different people, and it means that the burden of countering the spread of the virus is, under stay-at-home, extremely unequally distributed. Now, that would be okay under two sets of circumstances. The first set of circumstances is if, as we are now experiencing it, it is a short, sharp shock in order to get us through a kind of a temporally limited hump. Right? We flatten the curve, we get the community transmission down to a certain level, and then we can stop. It's acceptable, I think, not ideal, but acceptable under those circumstances. It's also acceptable, I guess, if we have no choice. If the other alternative is mass death, going the route of just allowing the virus to spread uncontrolled through the community and seeing where the chips fall. That is clearly not an acceptable policy, though it is one that has been at various points mooted by different governments. What's going on in Sweden right now may or may not be something that is can be included under that rubric. It's certainly not something that is socially acceptable here in Canada, nor do I think it's something that's morally acceptable. If it were our only choice, we would be in a moral conundrum. We would essentially have to choose between two extreme bads. On the one hand, continuing a policy that has these inegalitarian implications, or the even worse bad of courting mass mortality. What I want to suggest in the last 10 minutes or so of my talk is that we may not be in, I want to say one other thing before I move to my solution. There are more than just moral reasons to want to limit the degree to which we engage in stay-at-home policies as the main modality of our social distancing policy, which has to do with other objectives, which I think we quite appropriately pursue in the area of health. People have mentioned, but nobody has really, as of yet, made a full reckoning of what the mental health costs will be of prolonged periods of confinement. It is, in a way, an unparalleled and unprecedented experiment that we are going through now of requiring of people, very often people who live alone, very often people who live in difficult family situations, that they confine themselves for weeks and weeks and months. We know somewhere in the back of our heads that this will have a mental health impact, but we are so, as it were, consumed with the virus itself that we sort of put that on the back burner. I think that any steps that we can take in the short term in order to alleviate that long-term human cost of mental health problems associated with confinement would be probably a good investment. And there are obviously physical costs associated with confinement. Many medical conditions that put people at greater risk of very negative critical conditions ensuing from COVID-19 are alleviated by regular exercise, which is more difficult to achieve if access to the usual modalities of exercise are denied us. So there are all kinds of reasons to think that if we are going to have to pursue social, or as I prefer to say, physical distancing, we're going to have to find a way of doing it that is other, or that limits the degree to which we do it through confinement to the greatest degree possible. Is there a logical space there? Is there a logical space that allows us to think about physical distancing without just assuming that that's going to mean confinement and staying the F at home, as the fashionable slogan goes? I think that this is where we really need to start thinking outside the box about ways in which, if we need to social distance or physical distance over the long term, we need to start thinking about fairly radical ways of reorganizing the way in which we live our professional work lives and even our lives of leisure in space and in time. The basic thought that I want to sort of propose to you, and I hope have discussed, is that at present, our usual lives pre-pandemic make a very inefficient use of both space and time. We don't distribute ourselves as efficiently as we might through both space and time, and therefore we don't use space and time in a way which maximally conduces to physical distancing. So let me start with a more familiar thought, I think, of space. So one of the areas in which policy at the municipal level, but also at provincial levels, has been a little bit contradictory, has been with the management of space. Here in Montreal, the municipal government has taken steps to make it more difficult for people to access green spaces. For example, Mount Royal, our large park in the center of the city, has had its parking lots closed, which makes access to this vast expanse basically unavailable to all but the people who can reach the park by either by walking or by public transport, and public transport has its own risks associated with it at present. So it really has made the access to the park difficult for anybody who can't walk there, who doesn't live within walking proximity. Now, the argument is presumably that if you have big attractive spaces that are open to people, more people will leave their houses and therefore not comply with the stay-at-home policy. They'll be attracted by the park and you'll have more people out than would otherwise be the case. The fact that that policy, it has something, it should be questioned, is implicit in another step that the municipal government has taken just recently, that of widening the sidewalks in certain main arteries through the city so that people can walk on the sidewalks whilst respecting the 2-meter sort of safe distance from other people. So one of the effects of closing the park might be that people stay home in greater number. Another effect, which opens or invites the harm reduction thought, is that these people who want to go out quite legitimately in order to exercise, in order to sort of leave their perhaps straitened home situation to some degree, will be that they will just leave the house and take to spaces in which it is much more difficult to physically distance. They'll walk on sidewalks, on main arteries, where those of us who have done so have noted the sort of intricate but ultimately unsuccessful ballet that goes on all of our sidewalks as we try to avoid one another without ending up in the middle of the street. So what has ended up happening, essentially, is that while on the one hand they have closed big attractive green spaces, the municipal government has widened artificially some of the sidewalks by essentially taking out one of the rows of parking spots for cars, thus giving pedestrians a broader berth along a number of arteries to walk. So my first argument is that's the line of thinking that we should follow. We should open up space in order to make it capable of absorbing more people who can use the space while satisfying the 2-meter distancing requirement, rather than closing spaces in the hope that people will just stay home, which I argued at the beginning of my talk is probably an unsustainable and in some respects undesirable policy goal. So I think that we have a much more, especially in a city like Montreal that is blessed with a lot of green space, especially Mount Royal. I think that there are good reasons to open up as much space as possible, open up parking lots, open up schoolyards, perhaps not the play areas within those schoolyards in which children are naturally led to coming into contact with one another, but perhaps the expanses in order to augment the amount of space that people have, as it were, to spread themselves out on. So I want to say something now, having said something about space, I now want to say something about time. Time is perhaps more than even space, an inefficiently used resource. Think about our normal lives. We use 8 hours of the day in order to cram just about all of our educational and professional work lives, into those 8 hours, leaving the 16 other hours more or less vacant or discretionary. We work roughly from 9 to 5. Our kids go to school roughly from 8 to 4 or thereabouts. Shops perhaps now are open a bit longer, but basically 9 to 5, 9 to 6 is shopping time as well. And so we create situations which we don't really have to think about in non-pandemic times, in which predictably gluts of people coagulate in a number of different settings. Public transportation at rush hour, our own workspaces in which it's difficult to work without coming into contact with people at less than 2 meters. Shopping also has stress times when people get back from work just before the store shuts to get their groceries done. We use time in a way which is maximally conducive to creating the kinds of groupings of humans that we want to avoid in pandemic times. Now, as with respect to space, policy responses with respect to time have been similarly sort of contradictory or in tension. In Montreal or in Quebec, those of us who have been listening to how the government is starting to think about deconfinement, one of the policies which is being very seriously considered and which I imagine will be enacted as far as return to school goes, is to divide school into 2 periods of the day. So at no point would all the school children in a school be in the physical structure of the school together. There would be a morning cohort and an afternoon cohort, and thus you've divided the number of children who have to share space with one another into 2 just by dividing the day into 2. So the thought that we have to play with the elasticity of time, or the amount of time that we actually have at our disposal, in order to create circumstances in which we can avoid tight groupings, in which we can instantiate distancing, has come very naturally to people as they think about the reopening of schools. On the other hand, we've seen measures that have been taken for reasons which are quite understandable, but which don't make sense if we focus on the distancing requirement, that go in the other direction. So in Quebec, we have reinstituted a Sunday closing in order to give people who work in the stores a chance to rest, perhaps in order to give stores a chance to disinfect more effectively than they might otherwise do. But from the point of view of avoiding clustering, that just doesn't make sense. Anybody who's looked at a grocery store line Saturday at around 7 o'clock, people who know that they won't get to go to the grocery store before Monday morning, realize that there are costs from the point of view of distancing with the sort of constriction of the time that we have to engage in such essential activities as shopping for food. So the wild proposal that I want to, so clearly, if you've been following me thus far, my thought is that the former, rather than the latter thought, is the thought that we should be encouraging in these pandemic times. Let's use the full resource that time presents us with, just as we should use the full resource that space presents us with, in order to augment the capacity of people to distance from one another. Why not imagine a number of institutional spaces that we find ourselves in open around the clock? This might not make sense for schools, although thinking unimaginable thoughts is something that I think the present situation requires us to do. If anybody had predicted the circumstances that we presently find ourselves in, even just 6 weeks ago, would have seemed completely unimaginable. So thinking the formerly unimaginable, I think, is something that is required of us at present. But certainly other institutional spaces, be they leisure or work, can function around the clock in order for people to get their hours in at different times of the day, in order to minimize the degree to which they will necessarily come into contact with one another. I realize that I'm running short of time. I'm really, this is really just a set of, for the time being, maybe not even half-baked, but quarter-baked ideas, which, I either want to have, refuted so that I never think them again by all of you during the question period, or hopefully have you help me to refine them. But basically, this is the thought. The thought is that we get out of the kind of impossibility situation that I described at the beginning. We have no way of limiting the spread of the virus except through distancing. Distancing equals stay at home. Stay at home is not acceptable for reasons of sustainability, but also for certain moral reasons as well. Therefore, we're screwed. The way out is by loosening the equation between distancing and confinement, between distancing and stay the F at home. And to do so, we have to use both space and time more efficiently than we presently do. And I'll end by suggesting a benefit that this might have in terms of compliance. This is just an intuitive thought, and it may prove that empirical research, all of this, of course, is entirely refutable by empirical research. We have to have an experimental attitude towards all of these proposals. One of the hopes is that you will get more willing compliance. If I'm right about what I said at the beginning of my talk, it'll become more and more difficult to enforce stay-at-home policies into the spring and summer, absent pretty strenuous and pretty socially very difficult to accept set of policies to do with enforcement, to do with fining, to do with snitching of neighbors upon one another. The hope is that by allowing people to go about their activities, or at least some of their activities, in obviously extremely transformed way, through the kinds of distancing measures that I have suggested that sort of exploit our ability to make better use of time and space than we presently do, we will get more willing compliance, compliance that doesn't require the kind of heavy-handed and ultimately, I think, unsustainable enforcement that staying at home will increasingly require.